Good afternoon. As a member of the Kaw Nation and a representative of the thousands of dedicated staff members across the IHS, it is an honor for me to be before so many distinguished leaders, tribal and urban Indian organization leaders, and our federal partners from across Indian country. Your presence here reflects the collective commitment we share, strengthening the health and well-being of American Indian and Alaska Native communities. Today, we want to express our deep gratitude and to recognize the partners whose leadership, advocacy, and collaboration make the Indian Health Service effective, responsive, and culturally grounded. We are proud to honor 4 exceptional partners whose vision and collaboration have strengthened the Indian health system. First, Direct Service Tribes Advisory Committee. If you'll please make your way forward. The Direct Service Tribes Advisory Committee was established to provide leadership and advise the IHS Director on health policy that impacts tribes receiving direct service from the IHS. They offer a critical tribal voice in shaping policy and advocating for equitable health services for all tribes, including those that receive direct care from the Indian Health Service. Please help me congratulate them. Next, Tribal Self-Governance Advisory Committee. Yes, please come forward. Tribal Self-Governance Advisory Committee advocates for tribal self-governance and provides policy guidance on implementing the IHS Self-Governance Program, which empowers tribes to tailor and manage health services according to the needs of their community. Congratulations. The National Council of Urban Indian Health. Please come forward. The National Council of Urban Indian Health serves as a national resource center supporting the development of quality, accessible, culturally competent health services for American Indians and Alaska Natives living in urban areas. NCUI amplifies the voices of urban Indian organizations, ensures that issues impacting urban American Indian and Alaska Native communities are recognized in policy discussions, and strengthens connections between the urban healthcare providers and policymakers at every level. Congratulations to NCUI. And last but not least, the National Indian Health Board. If you'll please come forward to accept your award. The National Indian Health Board has been a steadfast advocate for the trust and treaty obligations owed to tribal nations and their citizens. For decades, NIHB has worked with tribal governments, Congress, federal agencies, and national partners to elevate policy conversations and ensure tribal health needs are advanced and honored. Congratulations to the National Indian Health Board. Today is also a celebration of the federal, tribal, and urban Indian organization relationship that makes the IHS work. The success of the Indian health system depends on the strong interwoven relationship between the Indian Health Service, tribal governments, and urban Indian organizations. This triad, the federal agency, tribes, and urban Indian health providers, reflects a continuum of care that reaches individuals and families in tribal communities, rural areas, and urban communities alike. Together, we address health disparities, build culturally responsive care models, and advance holistic well-being grounded in community voice and tribal sovereignty. And with that said, we have a special recognition today from our former IHS directors. We want to recognize 3 of them whose stewardship has helped shape the Indian Health Service and strengthen tribal partnerships. You've met them already, but let's bring them back again. Dr. Charles Grimm, Dr. Yvette Robideau, and Michael Wiaki. Dr. Grimm currently serves as the Secretary of Health for the Chickasaw Nation, who has long championed tribal leadership and health policy. Dr. Yvette Robideau has been the first woman to serve as the Director of Indian Health Service and as a visionary in public health and tribal federal engagement, and as we found today, the very first scholarship recipient to make her way through the program. And Michael Wiaki, who currently serves as the Deputy Director for Phoenix Area IHS, whose service reflects a deep commitment to tribal health and collaboration. To our recipients who have your honors there, we are honored to acknowledge each of you and will be adding your tribal seal to each of your photos. a symbol of the sovereign nations and communities you have served and uplifted. To all of the award recipients and to every leader present today, thank you for your dedication, your partnership, and your unwavering advocacy for healthier futures in Indian country and urban settings alike. Please, all of you, help me to have another round of applause for our partners, our champions, and our friends across Indian country. Mr. Cruz is coming. Okay. Okay, everybody get your photo? Excellent. Congratulations again.
Well, perfect. We have a little bit of extra time. We're running nice and well ahead of schedule. First, we'll take it. We appreciate everybody being here. So as you know, here at HHS, we are on the mission to make America healthy again. And as part of that initiative, between here at HHS and the USDA, they recently released the new dietary guidelines for Americans. And as you can tell, they flipped the pyramid upside down, really focusing on eating real foods and getting those into the diets. And that is something we're working diligently to implement here at IHS. But one of the ways we want to do that is by working with you in your communities to get these new dietary guidelines that are different than what we've had previously into our communities and into languages that people can understand and grasp. And so, as you can see here, our friends from the Navajo office worked extremely diligently over the last couple of weeks to get those together, and our friends at ASPA got these printed. But if you are interested in getting the new dietary guidelines for Americans, translated into your language, we would love to coordinate with you and your language departments at your tribes to get those translated and add them to our repository to be circulated in different clinics and facilities across the IHS systems. So, if you've got an interest in joining us in that mission of making these new dietary guidelines and the concept of eating real food available in your community, please reach out to Nicole Adams at ihs.gov. So I think it's nicole.adams at ihs.gov. She's our public affairs lead. She'll be coordinating that effort, and so we look forward to partnering with you on that. So appreciate it. And we'll go.
All right. Please welcome HHS Senior Advisor to the Secretary, Mark Cruz. Once again, welcome HHS Senior Advisor to the Secretary, Mark Cruz.
All right. Greetings, everybody. Waklisi, Yate'e, Hamidakiapi, Osio, Halalito, Baju. Greetings, relatives. I want to start by thanking everybody for being here today. And I can't express how much I'm enjoying my time here at HHS and working with IHS and the different optives and their tribal programs. Under Secretary Kennedy's leadership, he's given me one charge, and that is to make Indian country healthy again. Well, our interview went really well talking about different tribal programs, it was the things non-tribal that we talked about that really motivated me to come work with him. South Dakota, salmon recovery, fossil hunting. This man is an honor and a privilege to work with him. And it's been an incredible 8 months, from Oklahoma to Alaska, from Tanana to Aquinnah. I remain extremely excited about what's ahead. Friends, please join me in welcoming the 26th Health and Human Services Secretary, Robert F. Kennedy, Jr.
Thank you, Mark. And thank you, everybody, for being here today. I appreciate the tribal leaders and the members of the Secretary's Tribal Advisory Committee who are here today. Your work guides our decisions. This year we mark 70 years of the Indian Health Service, and I'm very proud that my uncle John F. Kennedy, as a freshman senator in 1954, voted to create the Indian Health Service, and it was one of his first votes and one which he remained proud of his entire career. For 7 decades, the federal government has carried out trust responsibility to provide health care to American Indians and Alaskan Natives. I take that responsibility very seriously. I spent 40 years doing and practicing environmental law, and about 20% of my time was devoted to representing the tribes in treaty negotiations and litigation against the extractive industry, against big polluters. And when I came in here, I made the pledge that I was going to be the best HHS secretary in the history of the office. Tribal leaders at that time told me that HHS needed more consistent and more direct engagement with the tribes, and I agree. Over the past year, I've traveled to reservations, tribal community, and IHS facilities around the country. I'm told that I've made more trips to Indian country than any HHS secretary in history, and I intend to keep up that cadence. I met with patients, providers, elected leaders. I listened to what works and where we're falling short. The Indian Health Service delivers care through federally operated facilities, urban Indian health care programs, and tribally operated systems under self-determination and self-governance agreements. Doctors, nurses, technicians, and administrators show up every day to serve communities that often face long distances and limited resources. My responsibility is to make that system work and to make it stronger. I strengthened tribal leadership inside the department. I created, for the first time in history, a senior advisor role for tribal affairs and appointed Mark Cruz, the Klamath tribe. And so Mark is, I see Mark almost every day. He's in on all the decisions, the major decisions made in this department, representing the interests of the Indian people and the tribal communities in everything that we do. I appointed Dr. Kim Hardwig of the Nez Perce tribe also to a leadership position at IHS. I delegated the authorities of the IHS director to Clayton Fulton of the Cherokee tribe. Tribal leaders should help lead the community systems that serve tribal communities. Today, I want to focus on concrete actions. First, we're going to phase out mercury-containing dental amalgams at IHS facilities. We know from the science, from gold standard science, that mercury in dental fillings is damaging the brains of children, and particularly when they drink hot drinks, it off gases. And when I learned that tribal facilities are still doing mercury, the dental facilities are still doing mercury amalgams, I said, I want them out. And I'm very, very happy that the agency was able to comply very quickly. We reviewed the science, the operational impact. We decided to transition to much safer materials. IHS clinics will adopt modern alternatives that protect patients and that align with current standards. Second, we launched the largest hiring initiative in IHS history, Right now, IHS face a 30% deficit in personnel. That shortage strains providers and limits access to care. We conducted a system-wide assessment to identify the most critical staffing gaps across hospitals, clinics, and administrative offices. We built a 2026 hiring plan that targets high-need roles and high-need locations, and we are streamlining recruitment to make sure that we get that personnel out to your communities as quickly as possible. We're going to bring more physicians, nurses, behavioral health professionals, dentists, and support staff into the tribal facilities, and we're going to work to keep them there. Third, we're addressing infrastructure. During my visits, I walked through facilities that badly needed renovation or reconstruction or just replacement. I reviewed a construction backlog that is $8 billion. We allowed that backlog to grow for too long. So this year, I'm planning to direct $1 billion in existing departmental resources starting in fiscal year 2027 and spread across the next few years to priority projects that are ready to move forward. We're going to direct those funds to facilities that need the most. Workforce and infrastructure form the foundation of care. Prevention and long-term health must follow. HHS worked with the Department of Agriculture to update the dietary guidelines for all Americans. We reviewed the guidance to emphasize whole foods, healthy proteins, and healthy fats, including seafood and legumes. Well, when we were doing the guidelines, one of the things that I talked about with the team that was doing them, was the need to get traditional foods back to reservation lands. Right now, the amount of processed, 70% of the food that's eaten is ultra-processed food, and it is poison, and particularly for Native Americans, it is doubly dangerous. Many tribal communities have practiced the principles of traditional foods for millennia, and across Indian countries, tribes are restoring fisheries, expanding bison herds, building hydroponic systems, and operating community food programs. And we intend to do everything we can to support those projects. When I went up to Tanawa, which Mark Cruz mentioned in Alaska, we found a greenhouse that had been funded by this department 15 years ago, and it had never been completed. There was piping that was still missing. I think it was about $1 million or $2 million investment. This is a very isolated community that is a 6-hour drive on a dirt road from the nearest large city, and they have a whole winter where they can't get fresh food. And this greenhouse will allow them to grow fresh food there, and we were able to restore the greenhouse. Tribal governments are strengthening food sovereignty and improving nutrition through their own leadership. And our role at HHS is to support them and to help them. We're going to align federal nutrition policy with tribal priorities. We're going to improve coordination across the agencies, USDA, Interior, the BLM, and HHS. We're going to reduce administrative barriers that limit access to food and health programs. We're also confronting behavioral health and addiction, which disproportionately burdens tribal communities, and that challenges many of the other things that we're trying to do in those communities. IHS and SAMHSA are expanding access to treatment and recovery services. We're increasing staffing for behavioral health services. We're supporting sober housing. We're funding, and I've seen incredible sober housing projects done in Arizona and many of the other tribal communities across the country, and some of them are role models for what we should be doing nationwide. We're funding culturally grounded recovery programs that the tribes design and operate themselves. As somebody who's worked for 40 years on tribal issues, the concept of sovereignty is at the heart of everything that I do. When tribes lead these programs, they improve outcomes. We've seen that again and again. The tribes can run the programs consistently better than the federal government. We're going to continue supporting these models. The Rural Health Transformation Program also gives us tools to strengthen care in tribal communities. Through this 5-year investment, we're working with states to direct resources where they're needed most. Alaska is integrating traditional healing into clinical settings. Idaho is dedicating funding to its federally recognized tribes. Maine is expanding substance use disorder treatment through tribal providers. Washington State is strengthening workforce development and care coordination for Native families. Federal funding works best when the states coordinate closely with the tribes and the tribes shape the implementation. We're going to continue pushing for that alignment. 70 years after its founding, the Indian Health Service remains central to the federal trust responsibilities. That responsibility requires action and not rhetoric. We're going to fill the vacancies. We're going to mobilize and modernize facilities. We're going to strengthen prevention. We're going to expand access to behavioral health care. We're going to improve coordination with the tribes at every level of this department. I value your partnership, your candor, and your leadership. I've asked all the tribes whenever I visit them, tell us what we can do. Give us concrete things that we can do, because we want concrete accomplishments at the end of this 4-year term that I can point to for the rest of my life. I value your partnership, and together we're going to continue strengthening the Indian Health Services and improving health outcomes for American Indians and Alaska Natives. Thank you all very, very much.
Produced by the U.S. Department of Health and Human Services.